Well, I was asked to go ahead and do a demonstration of what I'm doing when I'm doing an acupuncture exam and when I'm doing acupuncture on a horse. So this is Charlie. He was brought to me because he has a lameness issue that started not too long ago. So we're going to go ahead and scan him, see where he's painful, and then treat him. The first thing I'm going to do is introduce myself to the horse. Just pat him down. Make sure he knows I'm here. Hi, Charlie. How are you? How are you? Once he realizes I'm here and I'm interacting, I know. What I'm going to do is I'm going to examine his tongue. The exam of a tongue on an acupuncture exam is actually extremely important. It's going to tell me how I'm going to treat him today, in part. I'm looking at the tongue color, I'm looking at the tongue wetness, I'm looking at the coating on the top of the tongue. The next thing I'm going to do is I'm going to feel his pulse. The pulse tells me the same thing. I'm looking at the quality of the pulse, the depth of the pulse. The pulse has different positions. It tells me things about the kidneys, the spleen, the liver, parts of the body, and I can feel it in the pulse. So after I finish doing his tongue and his pulse exam, the next part is kind of the coolest part of his exam, and that's going to be the scan, the acupuncture scan. What I'm going to do is I'm actually going to move his mane over a little bit. I'm going to do a little test area. There's no acupuncture points here in this area. And this is how I expect him to scan when he's negative, when there's no scan. Now what I'll do is I'll scan different acupuncture points. I'll usually start here. Okay, do you see that response? That's actually a positive scan. Let's go back. Negative here. You see this? This is a positive scan here. You see that scan right there. This is a positive scan. That's a positive scan. He does not like that. What's happening is I'm actually touching different trigger points. I could do it with anything. I just happen to use this needle cap. I could use a pen or anything else that's firm. And I'm rubbing over different acupuncture points. And if those points are alarm, in other words, if they're trigger points, that's indicative of different areas that could be painful. There's essentially 3 different places on a horse's body that could be triggering when I treat an acupuncture point. Let's say, for example, that point that I scanned up there. And that point that I scanned up there actually scans for the opposite side on the fetlock, on the hip, or on the stifle. But it also could be pain up in the polar neck area, or that point actually refers to certain parts of the inside of the body. So I have to actually take that into consideration with the other points that scan. There's acupuncture points here as well, and there's acupuncture all across here, and different parts mean different things. Some of these points could be specific for stifle. There's a stifle zone, the hock zone, different parts of the body. They could be local to back pain, or again, respond to different parts of the body. There's acupuncture points that refer to stomach pain, and which respond to stomach ulcer, liver issues, kidney issues, lung issues, things of that nature. So all these actually scan negative here. Now that we scanned the left side, we're going to go ahead and scan the right side. Once again, we're going to just go ahead and do a test. This is what I expect him to scan for if he's negative. There's no acupuncture points right here. So I'm going to start. It's not positive yet. Needs to take into consideration that that may not be a scan. He kind of looks like he just doesn't like that. So keep in mind what that acupuncture point does, but at the same time it could be that he just doesn't like it. That is a positive scan. Go ahead and let him relax a little bit. That's a positive scan. Okay, so this is a positive scan here as well. You see how he twitches when I touch that acupuncture point. That was a positive scan right there as well. I want you to notice how he doesn't scan positive to these acupuncture points right here. But watch when I get to here. He does scan positive to those. It's a very, very positive scan. A horse without pain won't do that. Now, each of these acupuncture points actually tell me something different. I'm going to come back and actually scan him on this side, since he did scan positive on that side, so we can appreciate the difference of a negative and a positive scan. So this is an acupuncture point that scanned positive on the other side. You see, he's not responding to that. We'll go over to the other side so you can see what he does. He's not responding to this acupuncture point. Let's actually go to the other side. I want you to notice how he responds to the acupuncture, that same acupuncture point on this side. That's a positive scan. Positive scan. That trigger point triggers on this side. It's not a trigger point on that side. Those acupuncture points are acupuncture points that tell me that he has pain in his front foot. So based on my acupuncture scan, what I've done is I've looked at different acupuncture points. Many of them, most of them did not scan positive. Many of them did. The acupuncture points that scanned positive on him, you may have noticed on the other side, were slightly different from this side. A lot of the points that I did up in the neck and thoracic area on the other side scanned negative, but on this side they scanned positive. The points I actually did that scanned positive on this side indicate that Charlie has foot pain on his right limb, and actually it indicates he has foot pain on the medial aspect, which is the inside of his front limb. So there's something bothering him in that front foot that's on the medial aspect. The other thing is that one of the acupuncture points that he scanned positive for was a acupuncture point that states that he may have some bony changes. So he could have ring bone, he could have navicular, he has something, but it's bothering the inside of his front foot. In addition, a lot of the other points overlap back here, as far as some of these could be stifle or hip, they could be local points of the back, things of that nature. But when I total all of the acupuncture points together and see what overlaps with what, it actually is more consistent with hip pain. at some point Charlie has had some sort of hip issue. He used to be a roping horse. I don't know if that has anything to do with it. He may have taken a fall in the past. But in any case, he does have local hip pain, and his hip pain is actually more prominent than his foot pain. He does have both, and we need to treat both. So let's pause the camera and let's go ahead and treat him. So what we're going to do is we're actually going to start with treating some local front foot points for Charlie. And we're going to scan him to see if he scans negative afterwards, or if he scans lighter. Sometimes they will, sometimes they won't, but we like it when they do. In any case, acupuncture is accumulative. It usually doesn't respond after just one session. You need several sessions to get it going, and then over time you see more and more response until the problem is resolved. On occasion we do get immediately response, so let's see what happens here. We're going to go ahead and, so that we don't have to pick up the foot over and over and over and put it down over and over and over, we're going to go ahead and pick up some needles. Okay, so we went ahead and placed 6 acupuncture points in Charlie's foot. Using these acupuncture points, we should be able to clear at least some of the pain fairly quickly. So let's go ahead and rescan him and see if we've achieved anything different on our scan. We often won't, and that's okay because acupuncture is accumulative. It often takes several sessions to see the effect. And even if we get a negative effect, it doesn't mean he's no longer going to be lame ever again. What that means is we've cleared the pain at the moment. We're going to see how long we keep that pain gone, and then we'll repeat them again in about 2 weeks. Ready? It doesn't seem as responsive on that point anymore. Looks as negative as it seemed on the other side. He's not responding to that point anymore. So we did clear that immediate trigger point pain that was occurring on that side. Now let's treat his hips. His hips are more painful. Let's see if we could achieve the same effect in the back legs. So I'm going to go ahead and treat Charlie's hip and lower back now. We're going to go ahead and start with some points down low. He's really painful up high. So we're going to want to start in clearing some of that pain by treating these points down low. Some of these points will actually clear the pain along this entire acupuncture meridian. So I've treated points down low on the limb that will help hip and lower back pain. I do not expect with the needles that I've placed for all of this hip pain to be gone, but I do expect it to be improved so that when I needle him up here, it's more comfortable for him. You can put his foot down. Let's go ahead and rescan these points and get an idea how much has to clear. I didn't actually expect that much to clear. So he is still positive, as I expected him to be. But by no means is he scanning as much as he did. I actually didn't expect him to clear that much. So he did actually get a nice relief of his trigger points. Fantastic. Let's go ahead and put some hip points in, and this should be much more comfortable for him now. Actually quite impressed that he cleared that well with those acupuncture needles. So what we're going to do is, these are quite long needles. Got a 4-inch needle. Place a few more of those and then do some electroacupuncture. So this is Charlie getting his acupuncture treatment. You'll see he's become very relaxed. He's cocked over in the back leg. His head is down. His eyes are relaxed, blinking. He was smacking and licking just a little bit ago. What's happening is that the natural endorphins in the body are actually being released. It's the body's natural morphine effect. Serotonin, histamines, all of those type of chemicals in the bodies are natural being triggered to release in the body and do their job as far as helping the horse's issues. Amongst stimulating nerves, muscles, what we have going on here is a very gentle electrostimulation of some of these acupuncture points. Very gentle stimulation, nothing too intense. Sometimes you'll see the needles move, sometimes you won't. And after a few treatments of this, Charlie should no longer be lame.